Hello and welcome to the first section in Chapter 13 entitled Respirations. As always, this is Keith Woodmeyer with Wayne County EMS. I'm going to start out talking about what respiration is. Respiration is the exchange of gases between a living organism and its environment. Because cells use oxygen to produce energy, a properly functioning respiratory system is necessary for cell metabolism. Without oxygen, cell metabolism becomes less efficient and eventually stops. This leads to cell, tissue, organ and organ system damage and eventually death. If carbon dioxide is not adequately removed, acid builds up and changes in cell function result. This is really important for you to be able to differentiate between a respiration and a ventilation, which we'll get to in a moment. Big things to remember: respiration is the actual gas exchange, whereas ventilation is the mechanical movement of air into and out of the lungs. All right, let's get started on to some respiratory physiology. Tidal volumes. Tidal volume is the amount of air moved into and out of the lungs during a normal breath. At rest, a healthy adult moves about 500 milliliters of air with each breath. Of the 500 milliliters, about 150 milliliters remains in the anatomical dead space, where gas exchange does not take place. Patients with adequate ventilation are moving normal or near normal volumes of air into and out of the lungs. Minute volume is the amount of air moved in and out of the lung in 1 minute. This is determined by multiplying the tidal volume by the respiratory rate. For example, if the tidal volume of our patient X is 500 milliliters and their respiratory rate is 16 breaths per minute, their tidal volume will be 8,000 milliliters per minute, or 8 liters per minute. In a healthy adult, a minute volume between 5 and 8 liters is needed to maintain adequate oxygenation and effectively eliminate carbon dioxide. The amount of oxygen that reaches the cell can be changed by altering respiratory rate and depth. In inadequate tidal volume or respiratory rate, an inadequate tidal volume or respiratory rate can result in inadequate ventilations. Illnesses and injuries can affect the rate of ventilation, depth of ventilation, or both. Hypoventilation is a minute volume that is below normal. Breathing that is too shallow or too slow can result in hypoventilation. The lower the minute volume, the lower the amount of carbon dioxide the person is exhaling. Many conditions cause hypoventilation. For example, chest trauma, such as rib fractures, can impair the ability for the patient to adequately expand their chest wall. And this is going to ultimately affect the depth of respirations. Why do you think that might be? Well, if we have a patient who is having some immense pain in their ribs from a rib fracture, every time they take a breath, what's going to happen? That's absolutely right. It's going to hurt. So the patient will be cautious as to how deep they take those breaths because of the pain. Hyperventilation is a minute volume that is higher than normal. Breathing that is too deep or too fast can result in hyperventilation. A high minute volume indicates the individual is exhaling too much carbon dioxide. Causes of hyperventilation include stress, anxiety, stroke, head trauma, and aspirin overdose, among other conditions. The oxygen content of the blood includes the oxygen in the blood that is carried by hemoglobin molecules and dissolved in the plasma. Oxygenation is the process of loading oxygen molecules into hemoglobin molecules in the bloodstream. A hemoglobin molecule can carry up to 4 oxygen molecules. When 4 oxygen molecules are bound to the hemoglobin molecule is said to be saturated. Thus, oxygen saturation is a relative measure of the percentage of hemoglobin bound to oxygen. Oops, you know what? I'm sorry, I forgot to speed that up on my PowerPoint slide there. I'll give you guys a second to take a look at that. Is that long enough? You need a little longer? Okay, I'll give you another second or two. Alright, let's go on to the next slide. Pulse oximeter. Oxygen saturation can be measured by a machine called a pulse oximeter. You may hear it commonly referred to as a pulse ox. A small sensor is clipped to an area on the body, such as a fingertip. You may also see probes attached to foreheads, fingers, toes, ears. The clip that you see here, it's much like a closed pin. And the sensor is connected to the oximeter, which calculates the amount of hemoglobin saturated with oxygen and displays this value in percentage on screen. The percentage we're looking for, ideally, is 100%. It's important to remember that this really it's a tool. There's a lot of things that can throw off a pulse ox. For example, nail polish. People who have peripheral vascular disease, which means they've got poor circulation in their peripheries, in their arms and their legs, that can throw off the pulse ox. If somebody's exposed to carbon monoxide, that can throw it off. I'm trying to think. There's many things that can throw it off, so it's important to, it's always a good tool. Use every tool you have at your disposal, but make sure you judge your patient. The assessment is our primary tool. Using your brain, that is the best thing you can do. Hypoxemia is lack of oxygen in the arterial blood. Causes of hypoxemia include chronic obstructive pulmonary disease, such as COPD is the acronym for that, a blood clot in the lungs, which is a pulmonary embolism, fluid in the lungs, this is referred to as pulmonary edema, severe pneumonia, congestive heart failure, and inadequate oxygen in the surrounding air, such as in a confined space. Hypoxemia leads to hypoxia, which is lack of oxygen available to the tissues. Hypoxia may result from decreased amounts of oxygen in the air, loss of hemoglobin or hemoglobin function, decreased production of red blood cells, poisoning of substances within the cell, or diseases of the respiratory or cardiovascular system. External respiration is the exchange of gases between the alveoli and the red blood cells in the pulmonary capillaries. For optimal exchange, there must be good ventilation of the alveoli and good perfusion of its capillaries. Now on to internal respirations. During internal respirations, energy is released from molecules such as glucose and made available for use by the cells and tissues of the body. This process is called cellular respiration. During cellular respiration, oxygen and carbohydrates produce energy and create carbon dioxide and water as a byproduct of metabolism. An intact circulatory system and normal cardiac output is necessary to deliver oxygenated blood to the tissues. Pulmonary veins deliver the oxygenated blood to the left side of the heart for distribution to the body tissues via the arterial circulation. Carbon dioxide produced in the cell during internal respiration is absorbed by the blood, transported via the venous circulation to the right side of the heart, and eliminated through the lungs. This concludes Section 1 of Chapter 13, entitled Respirations.